Hello, this video is how to treat mouth sores from chemo treatment. My name is Marnie Clark and I'm a breast cancer survivor and a breast cancer coach. So are you going through chemotherapy right now? If you are, leave me some comments down below the video. I'd love to hear from you. So if you're looking to avoid the mouth sores that can result from chemotherapy, or you're looking to get some treatment for some that you already have, please stick through to the very end of this video because I've got some really important information for you and I don't want you to miss out on anything. I've created two sections of this video. One is for those of you who are looking to avoid the chemotherapy mouth sores, and the other section is for those of you who are looking to treat ones that you might already have. So the mouth sores, they're also known as oral mucositis. Great name, right? They happen because chemotherapy acts by targeting rapidly dividing cells. Now, unfortunately, this badly impacts your gastrointestinal tract, right from your mouth clear through to the other end, because those cells fall into that category of rapidly dividing cells. So stick with me. I'm going to show you some slides and we'll get on with this. I want to teach you about an amino acid called L-glutamine, which works really well in protecting against chemo-induced mouth sores. L-glutamine is anti-inflammatory, it inhibits bacterial toxins, and it works on a cellular level to repair tissues. I recommend getting the powdered form of L-glutamine. You should be able to get it from your local health food shop, drugstore, chemist, or even Amazon. The reason for taking the powdered form over the capsules is that you are going to be taking mega doses of L-glutamine, and taking large amounts of gelatin-based capsules each day can be bad for your health. They can put a strain on your kidneys and liver, and they are also more difficult for your body to break down and digest than the powder. But please don't worry if you're taking other supplements and gelatin-based capsules. If you're okay, but as I said, we are going to have you mega dosing on L-glutamine. You can mix the powder with cool filtered water. It's not recommended to mix it with juices or smoothies because that interferes with the absorption of L-glutamine. And please stay tuned for the dosage that's coming up. Never combine L-glutamine in warm or hot liquids because heat destroys glutamine. This protocol will work best if you start it close to the beginning of your chemotherapy regimen. If you wait a few weeks to start it, or wait until after the mouth sores already have begun to appear, it's like playing catch-up and it takes a lot longer to work. Another benefit of L-glutamine is that it also helps to reduce the chances of having neuropathy, which is one of the common side effects of certain chemo drugs, which are hell on your nerves. Neuropathy is damage or dysfunction to the nerves, and this can cause numbness, tingling, muscle weakness, and pain in your hands or feet. Taxol is one of the chemo drugs that most often causes this, and it is not fun. I've linked to some research on glutamine and neuropathy below this video. So here's how I recommend taking L-glutamine to avoid mouth sores from chemotherapy. If you want to, you can pause the video and write this down. It's best if taken on an empty stomach into a small glass that is 6 to 8 ounces or somewhere between 177 to 236 mils of cool, not even lukewarm, cool filtered water. Add 10 grams of powdered glutamine. And you swish this solution around in your mouth for 30 to 60 seconds and then you swallow it. Continue this procedure until the glass is empty. You can gargle with it if you like. Repeat this every 8 hours. For instance, in the morning, 30 minutes before breakfast, at midday, 30 minutes before lunch, and before going to bed or early evening. Try not to eat anything for at least 30 minutes before or after the dose so as not to dilute its effects. Start doing this on the first day of your chemotherapy infusion and continue doing this for 2 weeks after the very last dose of chemotherapy. If mouth sores persist past this time, continue the protocol until around a week past the time they finally disappear. A big shout out to Dr. Brian Lawenda, integrative oncologist extraordinaire, for sharing the proper dosage of L-glutamine. I used glutamine all the way through my chemotherapy treatment, all 6 months of it. And it protected me for most of the time. Towards the end there, though, I did develop 1 or 2 very painful mouth sores. Oh my God, they are so painful. And I found out later that I wasn't taking quite the required dose. It was much too small, and I was also using it in tablet form rather than in the powdered form, and I think the powdered form really does work better. If you already have mouth sores, and that's why you're watching the video, go ahead and use the protocol I just shared because it will definitely help to heal the problem quickly. In addition to the above glutamine dosing, rinse your mouth with a solution of either 1 teaspoon of Himalayan sea salt dissolved in warm water. Do not drink this down, just swish it around and spit it out. Or a drop of peppermint essential oil in a glass of water. This you can drink after swishing the solution around in your mouth. It is powerfully anti-inflammatory and will help calm down your gut as well. Or 1 drop of rosemary essential oil in a glass of water. This you can also drink after swishing the solution around in your mouth. If you don't like the taste, you can spit it out. It is strongly antimicrobial and will help the tissues in your mouth heal. And it's definitely beneficial to practice good oral hygiene and brush and floss your teeth after each meal. You want to keep your mouth as clean as possible. So I'd recommend doing one of the 3 procedures above after brushing and flossing. After each brushing and flossing session. That's easy for me to say, isn't it? For instance, in the morning, do the sea salt rinse. After lunch, do the peppermint rinse. And before bed, do the rosemary rinse. So I hope you found this information helpful. And if you did, leave me a comment below the video. I sure would like to hear from you. And if you'd like to learn loads more about how to successfully heal from breast cancer, sign up for my newsletters. One of my clients said, "Marnie, you took me from a place of fear and anxiety about my diagnosis to a place of calmness, healing, and even thriving. I can't thank you enough for your help." So sign up for my free newsletters. The link is below. Please don't do this journey on your own. It's scary, it's exhausting, and confusing, and I am happy to help you. Thanks for watching.